Parents often, when they report their child being anxious in a session, I already sense a little bit judgment, a little bit of rejection, a little bit of even guilt. Anxiety needs treatment. If there is significant amount of anxiety, let's just please be open to getting a counselor involved. Experts are equipped to be able to get children to understand what those thoughts are, how those thoughts are irrational. I think a lot of parents themselves are so afraid. And as a mom, I do understand that there are certain inhibitions, there are worries. So don't be afraid. Second, don't reject anxiety. This is your child manifesting and giving you the opportunity to actually find something that's hurting. Your child is trying to communicate something. Anxiety needs treatment. Right? So if there is significant amount of anxiety, let's just please be open to getting a counselor involved, because it's the emotion that we see and the symptoms or the manifestations that we see, but it comes from thoughts, and experts are equipped to be able to get children to understand what those thoughts are, how those thoughts are irrational, etc., etc. So please remember that anxiety does need healing. It needs a lot of specialized work. That said, we of course have to try and cope with life, right? So I'd love to empower you with at least a few bits that can be done. Number one, don't be afraid of anxiety. I think a lot of parents themselves are so afraid of sending their children back out. What if this happens? What if that happens? So I think, and as a mom, I do understand that there are certain inhibitions, there are worries. So don't be afraid. Second, don't reject anxiety. Anxiety is, it's not at the face of it, not always an abnormal emotion. In fact, sometimes very, very helpful and constructive. So it's very important for us to understand. I might sound a little bit repetitive, but please do empathize. We've all felt anxiety. We've all felt out of sorts. So you know the feeling. You may not be in the same situation, but you know how anxiety feels. And so share that. Let them know that you know how they feel. And that is very helpful in forming the connect that I've been talking about repeatedly. I think conversations are very important. Do let them know that there will again be, a change, and how change can be good, how change can be challenging and difficult, and that you are there for them to always turn back to. The key will be listing out one or two helpful coping strategies. So if you feel like this is the adult you can reach out to. If you feel like that, these are some of the things that we can do. So talking about some 2 or 3 coping strategies and letting them have their pockets full of these ideas, I think that's very important. Stay patient through the whole process. Parents often, when they report their child being anxious in a session, I already sense a little bit of judgment, a little bit of rejection, a little bit of even guilt, where they feel they haven't done a good job. And anxiety has nothing to do, your child's anxiety doesn't have anything to do with you. This is your child manifesting and giving you the opportunity to actually find something that's hurting. Your child is trying to communicate something, and that is what is important. That is the focus, not you and what kind of parent you've been. So make sure that you isolate those 2 issues. And like I said, coping is the key. Once there is anxiety, all we need to do is find the right coping strategies for your child. And anxiety is easy to treat. So please do not lose hope. I think there's a whole generation of children who are facing this. So there'll be several examples to learn from, peer support groups, etc. But I have noticed that with children, anxiety, it always helps to prepare them a little bit beforehand of what to expect.